Welcome back to Shape of the City. I'm Clover Frederick, your host. Staying healthy is more than what we eat and how we exercise. We sometimes forget about the importance of caring for our teeth, especially baby teeth. Let's learn more from our guest today, Heidi Stark, a pediatric dentist and Lincoln Lancaster Board of Health president, and Gwendy Meginnis, the Dental Health and Nutrition Services Division Manager for the Health Department. Thank you both for joining me today. Now, let's start with Heidi. Heidi, tell me, when do the baby's teeth usually erupt?
Usually, children's teeth erupt around the age of 7 months, but everyone is a little bit different, so some can be born with teeth, and some children may not have teeth until they're after 1 year old.
Okay. Now, why is it important to care for an infant's baby teeth?
Well, we know from experience and from what research tells us that once you have a tooth in your mouth, it's actually possible to start having a cavity.
Okay, well, yeah, we better start taking care of it pretty soon then. By what age should the first dental visit be scheduled, and why should we do it then?
Well, hopefully most people have heard about the campaign that's been started by the American Academy of Pediatric Dentistry and the ADA, which is the American Dental Association, also the American Academy of Pediatrics. So that slogan is basically age 1 or first tooth. And the reason for that is probably twofold. Number one, so that children can be comfortable going to an office, so that if they do ever have any problems, the parents know what to expect. But then also there's a dental home so that the parents can be educated about how to prevent decay, and also in case of an emergency, they're not going to the emergency room right away, and they have a place that they can call so that they can get some help if they need it.
Now, how is a baby's diet important to their teeth health?
That's a great question. Well, children start getting cavities from the time that the first tooth erupts, and teeth can erupt very young. So what we want parents to understand is that you need to start brushing right away. A cavity develops when there's plaque on the teeth, and the plaque can host bacteria. If bacteria uses sugar from the diet, it can create acid and break the tooth down. What parents find most interesting is actually that the mother often passes the bacteria to the child. So we often will tell parents, it's very important for you to brush and floss your teeth and to not have any cavities. Because if you have a cavity and you're sharing cups or spoons or forks with your baby, then you can pass the bacteria to your child that will cause a cavity. Again, if the child has plaque on their teeth, then they get decay. A lot of parents assume, well, my child doesn't have a diet that's high in sugar because they don't get juice, they don't get pop, they don't get candy, they're too young, they might choke. But I have a sample of an example here of a young child who's only a 20-month-old baby. This child has only been breastfed, has never had a sippy cup, has not been fed with a bottle, but they have been fed table food. And this child, as you can see, has little white spots developing along the gum line. And so this child, unfortunately, has developed cavities extremely fast. These are the teeth in the front, okay? And then these are the posterior teeth. So when you talk about cavities and why are the baby teeth important, unfortunately, bacteria and the decay, it spreads, and it obviously spreads pretty quickly. And that's one of the reasons that we want people to be seeing their dentist regularly and to establish that home early on, because if they don't and they let the cavities go, not only can it be expensive and painful, and even kids can be hospitalized. Our doctors in our practice, one doctor goes to the hospital every week to take care of infants and toddlers who have so much dental treatment that they can't even handle it in the hospital. But we also want people to understand, if you don't take care of the decay in a child, then that decay obviously can be transferred to the permanent teeth, and then you have problems with the permanent teeth, which also is painful. And most people can understand that a toothache means you're going to miss some school, you might miss some work. And again, that's just a real problem for people's quality of life, not to mention the long-term effects of periodontal disease and diabetes and other things that develop and create other problems with our bodies.
Okay. Now, you mentioned a dental home. Explain to me more about what that is and why it's important to establish a dental home for both the children and the family.
Well, again, it's twofold. We call it anticipatory guidance. So in other words, we have parents who come in and they have questions about why a tooth is erupting or not erupting, and so we're able to put people at ease to explain, well, it's okay, everything is a bell-shaped curve. Some children will get teeth very young, some children will get teeth very late, and also the pattern varies a little bit with eruption. We're also able to identify if children have had trauma or what to anticipate if they do fall. Or a lot of parents have questions about the gap between the baby teeth, which is often caused by the maxillary frenum, which is the upper lip attachment. Anyway, so those types of things put parents at ease when they can sit down one-on-one with a provider and find out that those are all normal things, and then we can guide them on what to expect. We also can show parents how to brush their child's teeth. Most babies are not necessarily interested in having someone hold them to brush their teeth, but we like to remind people that just like you wouldn't let a child have a dirty bottom, some babies don't like to have their diapers changed. Well, you don't want your child to have dirty teeth because, again, if their teeth are not clean, they can get cavities.
Now let's speak with Gwendy for a moment. How can lower income, uninsured, or underserved children and families access the Dental Home Initiative?
We have some great resources in our community, and I'll start with the Lancaster County Health Department because that's where I work. But we have a dental clinic on site that targets, again, low-income, uninsured children and families. It will also see children and adults on Medicaid. They can contact our clinic, and we will serve as their dental home as early as age 1. We do see children as early as age 1 in that clinic. For the uninsured, we work with a sliding fee scale. It takes into consideration U.S. poverty guidelines, and it takes into consideration their household income and those number of living in the household. And even though we're working with significantly reduced fees, we'll also work with payment options with those clients as well. So that's one option in our community. Another option is we have People's Health Center. It's a federally qualified health center, meaning that it's getting federal funds to serve low-income and uninsured children and adults. They also operate on a sliding fee scale, so I'd encourage people also, looking into their program as well. Another great resource we have is the University of Nebraska Medical Center College of Dentistry. It's an academic institution, and because of that being a learning institution, training our future dentists and dental hygienists, they do offer their services for both undergraduate and graduate clinics at reduced fees. So again, a very great, valuable resource for people needing to access services on lower fees for service. We also have some grant opportunities in our community, and a lot of our agencies are partnering to make sure that we're maximizing use of our resources and referring and not duplicating services. But we have some grant opportunities, and one of those is the Community Health Endowment of Lincoln has funded a dental group. The health department coordinates that project for the community. But what it does, it enrolls private providers, including pediatric dentists. Heidi's one of those pediatric dentists participating in this program. Those dentists, we have about 23 dentists participating in that, as well as the health department, People's Health Center, and the College of Dentistry. The dentists have agreed to accept reduced fees, and the clients pay a small portion of their fee for service, and then the grant is paying a larger percentage of those fees, and that assists clients with accessing a dental home. We've already done 2 years on the grant, and we have 3 more years at least on community grant dollars. So we're fortunate to have some really great resources in this community.
Great, very good. Now, how can clients access the Dental Health Initiative?
Again, I would ask that they contact the health department. We have a dental coordinator that coordinates that project, and we can give them more information. We also have a Clinic with a Heart. That's a faith-based organization that's doing dental screenings and referral. And so if clients are going into their Tuesday evening screenings, they also work with us and People's Health Center and the College of Dentistry and the Dental Home Initiative, making the appropriate referrals too. Some clients may be accessing maybe services at the College of Dentistry or maybe seeking out but can't afford it, so the College of Dentistry is really good about, again, referring back to us and assessing those clients, their income and their eligibility. So we're really trying to match up people in the community to the right resources that match their situation.
Great, great. Thank you both for being here. I appreciate it. Now when we come back, we're going to give you some tips on how to brush your children's teeth.